Hi, Dr. Rob Kiltz. How you doing? Bmi Fertility. We're starting just a couple minutes early, and Will's here, help me in the background. And our Facebook Live is enhancing your fertility journey. And please submit your questions, and we're going to take them as they're excited about being here again and just sharing some thoughts and ideas on how to improve your fertility journey. Both natural, integrative, Eastern and Western approaches. And although we're fireside, it's still a little chilly in upstate New York. We had snow a week or two ago, but it is beginning to warm up, and spring is here in many parts of the country. And we're hoping to kind of warm it up even more to give you more advice and more help. And whether you're just one person there or the whole village, share the links, share the mission of affordability, quality, access. That's really the key to all of this. And again, I'm very grateful for everyone being here with us today. And I've got some questions already coming, and I'm going to do my very best to keep my stuff straight in line. And again, Jennifer, Natalie, Jasmine, Patty, hi to all. It's been a beautiful, beautiful winter. Spring started, and we're really excited. We know a lot of people are going to be traveling to upstate New York, Albany, and Syracuse from all over the country and the world. Our commitment is affordability. But it really is integrating and sharing a story of helping the natural process when it can happen, and when we know that there are barriers to that, IVF helps a tremendous amount of people, and the donor egg is always an option, and we have our donor egg add-on package, which is $1,000 an egg, which makes it much more affordable, and we recommend a minimum of 4, and 6 is probably going to be the very best. And I did have a great vacation, by the way. I went down to Florida and then to New Orleans, and just once I got to Atlanta Airport, saw so many of our success stories and those on the journey. And this is one of the hardest journeys you can ever be on. And I really feel for all the heartache and the emotions that everyone's going through. And we really are all practicing to listen and to learn, because the frustrations are tremendous. And our emotions really hit us hard. And I've been really practicing a lot of meditation and patience in the whole process. And I'm here to work 24/7, 365 to always be available. Although I worked to put my phone down while I was on vacation, I wasn't perfectly great at it. And again, share the likes, share the asked questions, okay? It really is so important. And there's a long wait sometimes to the consultation, whether it's physical or on the phone. My job and our docs, Dr. Grossman, Dr. Ditkoff, Dr. Corley are all awesome. And our practitioners at all of our locations are really always there to listen and learn. A lot of it through these live Facebook chats and webinars, the intention is to share these ideas. And again, your questions are really fantastic. In the wait, check out our YouTube, Dr. Rob Kiltz, where I talk about keto, paleo, inflammation, how to slow it down, yoga, meditation, and Erin, our yoga queen, is going to be doing a yoga for fertility. It's May 8th at 6 p.m. live. So Check out Aaron McCullough's Yoga for Fertility, and we're really a big sponsor to kind of help share Aaron's voice on how to slow it down. And I know that I'm high energy and fast pace. And again, questions, throw them out there. We're going to go an hour plus usually. And I'm really just sharing highs to everyone and grateful for all of the commitment to participating. And so many of our clients have been on this journey for a long time, and sometimes 5 or more years before the success happens. And really the important is to persist in the process. And I was listening and watching an Eckhart Tolle Power of Now, where he was doing a live webinar on presence, and for all to be present in the moments. And our emotions get the better of all of us. This is where yoga comes in and meditation, because it lowers the cortisol and epinephrine to allow the core to work its very best. Let's go down the list here and get moving. Hey Kelly, how you doing? What do I need to do 30 days before my IVF? Start yoga, meditation, slow it down, go for a walk with your partner, a friend, listen to something upbeat and positive. Check out Maria Emmerich's stuff on keto. Maria Emmerich is amazing. MariaMindBodyHealth.com. She has a lot more variety than Kiltz's keto, which is very narrow. I call it the Lion King plan, or the baby diet, bacon, eggs, butter, beef. But keto, paleo are really important. Maria Emmerich has a lot of solutions to help you on the journey. Narrow it down. Low-dose naltrexone. Look at the Theralogics supplements, Conception XR, Ovavite, Ovasitol. Conception XR for the guys, Ovavite for the gals. Ovasitol for both. It reduces glucose, insulin, inflammation. I recommend something called intermittent feasting. That means eat breakfast and dinner, or dinner. It's a crazy concept. Rather than intermittently fasting, spread your meals out, reduce the contents in the gut, which is where all the inflammation happens, and it affects the testicles, the ovaries, the uterus, the tubes, everything in here, that it then pushes the inflammation everywhere in our body. If you have diminished ovarian function and reserve, this is where I think that it's really important to add DHEA and possibly human growth hormone. So look at those as possibilities to help in the process. And I'm going to go to a couple questions that we got from Caitlin. Would like to know what to expect for their first appointment. Well, it depends if it's going to be a phone, a Facebook Live, or FaceTime Live, or it's going to be in person with either myself, one of our docs, or one of our practitioners. And it really is our chance to ask you your story, because ultimately your story is so much more valuable than that millions of pages of records. Although those are important, your story, what are your ages, how long have you been trying, previous success or failures, previous treatments, and anything about your body and your health and wellness, what medications, allergies, and I really touch on your allergies, both food, environmental, and medications. All of them are real important in the process. And really it's a 30-minute conversation. We most often we'll do some blood testing, an ultrasound to look at the pelvic organs, the uterus, the ovaries. That's the majority of what we're doing in the face-to-face. If it's simply over the phone, we're going to talk about those things. We absolutely can often have them ordered at a local doc's office, radiology. We use LabCorp for a lot of our blood work, and we have some sort of standard testing we recommend. None of it is required, but it's helpful. Look at your vitamin levels, look at your thyroid function, look at your AMH levels. Get an idea of what the sperm count has been like, morphology, motility. All those things are real important in the process. But it's listening and learning about the emotional stuff. How long have you been on this crazy roller coaster journey? I talk a lot about what are you eating? And there's no judgment here on my part. It's really so I can understand about what your body is consuming that may be a factor. So much of what I learned has to do with plant antigens, the allergic things that come from plant material, other microorganisms, the phytochemicals, including glycoalkaloids, cyanide, that maybe in some of the things that you and I take for granted as healthy, they may not be. So really the story is so critical, and then giving you some guidance of what are my options. Is it more natural approach? Is it going to be some intervention with either intrauterine insemination? Is it going to be to get a surgery like a laparoscopy, hysteroscopy, which I recommend a lot, looking for silent endometriosis. And again, we often don't know what's going on in there unless you look inside. And that's really the most important thing. Sometimes you have to look under the hood of the Ferrari. And I consider all of us most expensive, valuable, irreplaceable organisms of the universe. And so that's the gist of it. And Stephanie, how you doing, Stephanie? What are your thoughts on an elevated FSH? Hers is 16, and a low AMH levels for women under 35. So my general belief here is that the function of the ovaries and the testes is affected by the inflammatory reactions that go on in our belly and our whole body. It happens younger and younger and younger. Glucose, fermentation in the belly, glycation, and the plant antigens that we're allergic to that diminish the microvascular blood flow, the ovaries, the testes, that diminished ovarian function due to microvascular inflammation causes the brain how to send a signal to tell the ovaries to work harder. FSH goes up, AMH goes down. It may be reversible. Thyroids can go way down with increased TSH, and that is reversible by reducing the inflammation in our bodies. Low-dose naltrexone. Now check out the low-dose naltrexone book, or LDN book, and just look at it. It's an opiate agonist antagonist that reduces inflammation in the body. Phil Boyle in Ireland has been using it as a natural approach to fertility for many years and has found some really, really great results with that. DHEA, 25 milligrams 3 times a day, 75 milligrams can be used once a day. And I absolutely recommend slow it down. Stop running. Really great evidence that when we run or exercise, our blood flow is taken away from the core. Remember, ovaries are in the core. Blood flow goes away from the gut, goes to the heart and the extremities. It goes away from the brain, away from the liver, the gut, the ovaries, the testes, goes away from the kidneys. And so we think it's healthy for us, but in fact, it's opposite. And that's so much what I've been talking about. It's the opposites. It's crazy. But our body really is meant to go slow. Rest and digest and slow it down. By going keto, it's a term, ketogenesis. My opinion is we always burn fat. but because we eat carbs in the form of all plants all day, all night, all day, all night, we're constantly secreting glucose, which causes glycation and damage to every cell of our body, the blood vessels especially. That microvascular damage, right, shuts off the blood flow to the ovaries, which brings in oxygen and takes away carbon dioxide. And so carbon dioxide levels rise, oxygen levels diminish, mitochondria die, supportive cells around the ovary and the oocytes die, and our body goes into shock. Turn it around. Acupuncture, yoga, massage, DHEA, human growth hormone, they really do help a lot. And low-dose naltrexone. By doing serial stims for either IUI or IVF or intercourse, we seem to be able to improve the ovarian blood flow and the function of the ovaries. But even at higher FSHs and low AMHs, it's still possible to stimulate those ovaries and get viable eggs, embryos, and a baby. So quite commonly, you may want to up the stimulation dose in the 450 to 600, add the human growth hormone, and do up to a month of priming, maybe even up to 3 months of priming before you give up on that. Hey Maureen and Kristen, DHEA question, start 100 milligrams per day, have had 2 retrievals since, poor results, and had 11 mature with 1 fertilized first day, 3 more fertilized following day, and first one did not survive. 5 mature and only 1 fertilized again. Could DHEA be making my cycles worse? Lower the dose most likely. And again, it may be internally we're not able to correct it. DHEA isn't perfect. Are you on the LDN? Are you doing full-on keto? These are other things to make sure you're doing. And have you added human growth? Although I'm seeing in some people on human growth hormone, we get the opposite effect. And so remove that. And then in others who are trying to do the high dose, go low dose. Fewer eggs, fewer good quality eggs and thus embryos may give you a little better success than you were getting with that high dose. Remember, thanks for the sharing, thanks for the loving and liking, we really appreciate it. Again, our mission, affordability, quality, access, integration. And we're working with Maplewood Inn in Syracuse, but Schuyler, Genesee Grand, and many others. And check out Airbnb for local places to stay to make it more affordable, both in Syracuse and Albany, for those traveling for IVF. And really, the one thing I've focused is persistence, persistence, persistence. And so I hope that helped, Maureen. Megan, how you doing? How many days do you stim before a freeze-all cycle, started on Friday and at PCOS? So the typical number of days for an IVF, and if you check our website for the IVF calendar, is 10 days of stimulation, a trigger on day 10, retrieval day 12. That's the 85% rule. Some people will trigger on day 8, day 9, day 11, or day 12, but the 85% is going to trigger day 10. And typically, we're going to freeze eggs on the day of retrieval, sometimes the day after to wait for them to mature. We add sperm to the eggs on the day of retrieval, and then we're generally freezing embryos anywhere between day 2, 3, 5, 6, or 7. Now, the majority are day 3 or at the blast stage, day 5, 6, and 7. In those that do not make good blastocyst embryos, day 3 freeze-all may be better. I sort of have a little bit of a simple rule, which is always changeable. 4 or fewer embryos freeze on day 3, 5 or more go to day 5, 6, or 7, which is at the blastocyst stage. But again, it's individualized. If you have a high progesterone level or a significantly high estrogen level on the day of trigger, we generally recommend a freeze-all cycle. There is some evidence that freezing embryos and waiting to the next month may help improve your success. I've been recommending for those that are doing a freeze-all cycle, consider an endometrial biopsy or scratch with a hysteroscopy at retrieval. So don't forget to talk about it and ask about it. Plus intralipids in order to add the fat to reduce inflammation. Remember, bacon, eggs, butter, beef is the baby plan, which reduces inflammation. But if you're doing a fresh transfer, think about the HCG wash or the Neupogen wash at retrieval, plus the intralipids, and then some other more complex or complicated or more high gold platinum level is going to be IVIG and Humira, and we'll talk more about those in just a minute. And LaRocha, how you doing? Opinion about doing one big dose of Neupogen instead of daily injections. Well, you know, I don't know that answer. We're typically doing daily doses of up to 60 micrograms. It may be higher. It may be the intrauterine Neupogen wash. It's a growth factor which may help with implantation. I think I need to look at that a little bit more and see if there's some articles on that, but I haven't seen that. There's lots of different ways to do this, and we're learning every single day. We are hoping in New York, the ERA, endometrial receptivity assay through iGenomics, maybe some other companies are going to be using it, that we can start doing it here. We are encouraging those that have access in other states, we can do that to better time implantation for frozen embryo transfer. So that's just something else that really is good. Kayla, how you doing? Why chromosome deletion? Any success? Your husband is 36. Well, these are not absolutes. If there's a Y micro deletion, the success rates are far lower, depends what it is, but not zero. I always say give it a do. You got to try with the sperm you have, but consider donor sperm backup. And we are working on our donor sperm team in order to get some sperm banked to provide even a lower cost for that. Myra, what about weight training? Okay, light resistance activity is what I recommend. Your body comes with all the resistance. You know, this may be something. Yoga poses, Tai Chi. You know, it's interesting, at 62, I stopped exercising over 10 years ago. I slowed it down, went full on Lion King plan. For me, very narrow diet. I feel the very best ever. Bowels are best, all the joints and all the other stuff has really, really gone away. So, but light weights, that we're not gladiators. Rest, digest. That's what we're meant to do. Go slow. The racetrack Ferrari is going to break down faster than the showroom Ferrari. And if you want to go, you know, just for a little bit of a journey through the town and the village or the countryside, but go slow. That's really where it's at more than anything. Check out Nate Miyake. He's got some stuff on keto paleo and Tai Chi and some light strength training I think is really good. And hey Natalie, how you doing? No to exercise, but what about swimming up until before transfer? So light, go light and slow. That's what the body really wants. And it really wants fat. Fat is the energy for every single cell of our body. My bet is we never burn glucose. We convert glucose amino acids in the liver to sugar, fat, and store it and utilize it everywhere. And so light swimming, so make it more like a meditation, like a walk in the park. That's really the most important concept here, is make it all a walk in the park. And put some headphones on and listen to something really upbeat and positive every day. Check out my website, mindbodysmile.com, and I've shared a daily meditation. I have my new inspiration book on daily intentions. You can go online and download it. We're making it available for everyone, and check out our magazine, but low and slow. Hey Tara again, Angela. stand-up paddleboarding. Listen, that is like a walk in the park. You're enjoying participating in life, a light bike ride. And this stuff, fast, creates injury, friction, heat. And remember, it steals the core of the blood flow that your ovaries and uterus and testicles need. We're not out on the savannah. And really, the last time I had to go hunting for food, never. Although many people enjoy that. And remember, look at paleo, keto, and check out Bmi. There's so many great things. We've had so many of our patients suddenly get pregnant on keto paleo and slowing it down. Yoga for fertility. Again, check out Aaron McCullough stuff coming up May 8th. And so many are dropping the pounds, but it's not the weight loss. It's the change in the physiology in our bodies that matters. And really look at my keto stuff. And I just did a TEDx talk at Onondaga Community College a month ago. It should be coming out. Look at it and share it with your friends, your family. We've seen diabetes, hypertension, high cholesterol go away. And the brain feels so much better. And if you're eating healthy and exercising healthy, my bet is it's probably wrong. That's the amazing story here. The opposite. And as a reproductive endocrinologist, as a physician, I experienced my sister Maria passing at 52. Good friends died of cancer at a young age. I just see the struggle and heartache of infertility and know that ultimately all the problems we're experiencing come from what we put in our mouths, somewhat to what we put in our brains, because we get all stressed out, but the only stress-free zone is the cemetery, and we can wait for that. We work on our stress-free nature today, every day, and really this is about sharing some crazy concepts and ideas, and believe me, I didn't believe most of it. Hey Brittany, how you doing? Keto before IVF and male factor. Keto is king. Check out Andres Ianfeld, dietdoctor.com. And I've learned a lot from Andres Ianfeld, from Gary Taubes. A great one is the World Turned Upside Down, and this guy's amazing. It really is the stories of healthy foods that we've been supermarketed by supermarketers have actually made us ill. So keto before every fertility treatment, because so many of our patients are getting pregnant naturally. Sperm counts go up. Cycles regular again. PCO, polycystic ovarian syndrome, is metabolic disorder. It's caused by carbs. Remember, all carbs equal sugar. There's no such thing as almond milk. It's called almond paste, which is basically sugar. And almonds contain cyanide and maybe these simple phytochemicals, glycoalkaloids, cyanide, are adversely affecting our gut and our reproductive cells in every cell of our body. So also interesting is that once you're pregnant, stay keto. You don't need to measure your ketones, by the way. High fat. Protein's about 20%, and I say low to no carbs. Check out Bmi Emmerich's stuff. She is amazing, and we're sharing this story together. And she's done some stuff with Jimmy Moore, Jason Fung, keto. I know I'm a broken record. Your size doesn't matter. You don't have to lose weight. You change the physiology and metabolism inside your Ferrari. You're the most valuable and expensive entity. Look in the mirror every day, no matter what you see. It's the most perfect thing you could ever come across. It's amazing. That's who we are as human beings, but we've learned somehow to put ourselves down and feel that we're less I don't know where that story came from, but we are here all together to share in the CNY Fertility Facebook Village or Instagram or however you're sharing it. And check out our Instagram, and Carissa Barzee, CarisssaBarzee, is going to also be giving away an IVF, and we're working to give away an IVF cycle every single time we do a Facebook live event, and we're really making it affordable. $3,900 for an IVF, and we have full payment plans, and you could stack those as you need and bank also. And if you're looking just to bank eggs or embryos for the future, insurance plan and policy, and my recommendation is we should be suggesting it to those in their early 20s, not waiting. Guys potentially banking sperm, because if you stay on a standard American diet, you're gonna get all the inflammation and diseases. They're gonna wreak havoc on your reproductive system. Amazingly, I've seen keto, testosterone levels up, libido better for everyone. And it's an interesting process, but stay keto once you're pregnant. It really keeps the inflammation down. And for so many of the women out there that suffer from hyperemesis and nausea early in pregnancy, your body is trying to protect your baby from all the poisonous foods and excessive things you put in your body that cause inflammation, that cause the microvascular damage, that cause the blood clots and the rejection. So it's, again, it's opposite, and most of us doctors are still telling everyone fruits, fiber, vegetables, lean meats, and 3 to 5 meals a day, and I believe those are deadly instructions. Like a lion, you'll never see a fat lion or a lion exercise, and we are more like lions. But remember, as a vegan or a vegetarian or a standard eater, if you simply limit what you're putting in, be very narrow, separate it out 12 to 24 hours, because why do you put more fuel in a Ferrari and then get on a treadmill to burn fuel so you can go add more? We should be eating to live, not living to eat. And I know it seems kind of crazy, but interesting and fun. So, yes, the stand-up paddleboard, a little bit of light stuff. Remember Tai Chi and yoga, and share the I call it the baby plan, Kiltz's keto, which is a little crazy, I know, but I'm gonna go all the way on this one. It is the best you can ever imagine. Hey, Kristen, how you doing? High HGH for 30 days prior to first stim, and have been on LDN and keto since last year. Listen, I don't know why some things work and other things don't, but it really, really helps. And everyone doing okay out there, enjoying life, and I know there's a lot of stuff going on, a lot of words we're sharing, and keep sharing out there. Amber, how you doing? 0.122 AMH, would be able to use my own eggs, or would I need? Okay, so the story is important. The need of something always, if what you're doing isn't working, then you're ready to do something else. In fact, low AMH may just mean a lower ovarian reserve or numbers of eggs. It may mean a little bit on quality, but I've still seen plenty of babies from AMHs lower than yours. FSH is elevated, and the younger you are, ultimately that matters most. But I've seen 2As get 1 embryo and 1 baby. So the key here is persistence, persistence, persistence. And you know, it's, if you have sex 1 month and then don't get pregnant and you give up, well, you know what your odds are. So whether it's IUI, IVF, donor eggs, natural, whatever it is, find the way to be present in a new way. Learn the power of persistence, And as we share the words, and if you look at our book, The Fertile Secret, which kind of a spoof or takeoff on Rhonda Byrne's The Secret, is that in our minds we control and master the body. Even in the worst of the worst, if you hold the mind and be grateful for whatever is going on in your day, in your life, never, ever, ever give up. But we've seen so many with low MHs have babies, whether it's natural through keto, LDN, meditation, vision boarding. Look at vision boarding. It's a different concept, but that which you dream about comes true. Hey Amanda, how you doing? How long do you recommend waiting to do a second transfer after a miscarriage? It may be as short as 30 days, it may be as long as 3 months, when you're ready. Long as all the blood levels are back down to normal, your uterine lining is good, it may be reasonable to get right in. In some way, the miscarriage D&C may be priming your body, and you just keep on going. And so 30 days. And I'm so sorry you lost them at 6 weeks. Inflammation, immune, and look at leukocyte immunotransfusion, LIT. Look at IVIG, intralipids, Humira, Prograf, Plaquenil, and keto. And again, there are lots of different definitions of keto. People talk about burning glucose and then converting to burning fat. I think the problem actually is just excess glucose in our system all day, all night. And we're working to reduce the glucose because the acetyl-CoA and fat is all we burn. You can't measure the stored glucose, and I don't know who can, but there's no doubt about it. We have lots of stored fat. We all have it. Hi, Ramo and Saveda, a pleasure to see you again, and we'll talk. Sarah, how you doing? If you're allergic to soy, to take the place of intralipids. Butter. And for sure, get away from soy. For some people, that's our only mechanism. But if you look at David Osprey's book, Bulletproof Coffee, adds butter. He had some other things, but listen, butter is fat. You want to use grass-fed, spring grass-fed, and looking for butter oil. It's really pretty amazing, the concepts and ideas that all of this we're finding. It's when you eat fat, it goes directly to the lymphatics, and it goes directly to the heart, and it goes everywhere in your body. It reduces inflammation. So that's the other way. And I call it the baby diet: bacon, eggs, butter, beef, and cream. And check out on YouTube my steak and ice cream recipe, and a shout out for Side Hill Farms in Manlius. They got some really great grass-fed, really fatty ribeyes. Again, that's my one meal a day, plus my homemade ice cream, which is phenomenal. And again, I recommend the once a day rather than the seeds and nuts and snacks in between. It's really a crazy concept. Hi Nicole, Allison, always great. Dina, do you mean intralipids would be good around retrieval? So I'm thinking intralipids are likely good weeks before potentially, and maybe weekly for 2 to 4 weeks, and then weekly after transfer or after IUI or after intercourse, because the one thing we need to support more is the natural pregnancies. And IVIG currently every 2 to 4 weeks. And looking at natural killer cells, looking at ANA, ACA, lupus, looking at thyroid antibodies, and all of these are simply indications of inflammation. But in my opinion, if you're not conceiving naturally or you're miscarrying, you have inflammation. It's really a clinical diagnosis. And the genetic abnormalities that follow with the miscarriage, or the chromosomal abnormalities that we may see of biopsying an embryo, are actually the inflammatory changes that cause the damage at the DNA or the molecular chromosomal level. So it may be corrected by simply changing what you put in here and what you put in here. And there's a lot of evidence that meditation and slowing it down and Tai Chi and yoga reduce cortisol and epinephrine levels. Allows the core blood flow to increase. Testicles, ovaries, uterus. And I've seen fibroids and endometriosis, I believe, are all secondary to chronic inflammation everywhere in your body. And just think about it, that a simple bee sting or a speck, a dust of peanuts can kill some people, causing an anaphylactic reaction. My bet is so much of what we're consuming is causing exactly the same problems in all of us. Let me just drop down. Hey Sarah, how you doing? Tanya, Keisha, I have no BMI restrictions. Listen, if you're overweight, and so many of us become overweight, I've been there, so many family members and friends, but the struggle doesn't need to be a struggle. It can be recognizing that my size is my size. Now, how do I change the fueling of the Ferrari, no matter what you are? And we can help you get there. There's no you have to lose weight before you can do anything. Also, some of my surgical procedures, we really like it to be at a lower BMI because it's much harder. But definitely, our job is to share the keto plan, paleo plan. Find one. If it's working, keep at it. If it's not, we got to switch it up to the next level. Hey, Gloria, how you doing? Can you have a successful pregnancy with low betas? You know, these levels and numbers we follow sometimes can do weird things. And it's not an exact science. And I know we look at them and we're looking for science to tell us like absolute answers, but we're not capable of that. Thanks for hitting the like and hitting the share buttons, by the way. The more we share, the more we're able to help so many more people in this world. Let's see. Hi from Quebec. Hi, Jess. I have a phone appointment in July, and we look forward to seeing you guys, by the way. We see people from, Alaska, England, Australia, the Philippines, all over the world, but certainly in the United States, our $3,900 IVF is the most affordable. And that's always been my mission for 20 plus years, and we're gonna stick to that. Now, it's possible you may have a higher need of medications or other treatments, but our job is to listen to your story, help individualize your treatment, and always looking to help. So I hope I've been able to answer that. Never for it is crazy. So probably 80% of those in need of IVF and fertility treatment can't afford it in America, and the coverage is dismal. And in New York State, we're really trying to get everyone to share the need to make it affordable and accessible, and whatever your state you're in. And we've seen so many that have been trying for 10, 15, 20 years, and some simple little tweaks to what you've been doing can add to that success. Hey, Sarah, Tanya, Keisha, as I said, no BMI restrictions. And again, obesity and being overweight is likely from the misdirection of us physicians in the healthcare world. More fruits, fiber, vegetables, and lean meats, lots of seeds and nuts, and eat like a grazing animal. In fact, those are the causes of our problems. And all you need to do is look to keto. Again, Emmerich, Anders Sienfeld, Jason Fung, Jimmy Moore, so many. And check out mindbodysmile.com, and we're adding keto, and Maria's adding stuff, and we have a book coming later this year, which is really sharing same concepts, same ideas. And for those in your family that aren't infertile, but are having other struggles with autoimmune disease, hypertension, diabetes, share this concept with them, because that's the home run. That they'll be like, oh my God, my doctor never told me about ketogenic diet or paleo diet. That amazing, I don't need my diabetic, my hypertensive, my high cholesterol drugs anymore. And since I'm a reproductive endocrinologist and fertility specialist, we're seeing so much success in the process. Dhea, how you doing? 4 very early losses, clonal pregnancies, all via frozen transfers, good grade embryos. Hope. There's always hope. Have only positive energy. Don't let that go, and have faith that in one way or another the universe is conspiring for you. Check out Paulo Coelho's book, The Alchemist. If you haven't listened to it, Jeremy Irons is amazing. Great read. And this is where leukocyte immunotransfusion, IVIG, Humira, Plaquenil, and laparoscopy, hysteroscopy for endometriosis, fibroids contribute to that. And really amazing. Simple things like Lovenox, baby aspirin, prednisone to reduce the inflammation in our bodies. But hold the belief, don't let go, don't quit. And again, thanks for sharing the likes, and thanks for sharing the loves. And I just, every day, share gratitude and love to all of our clients. And listen, I know sometimes I'll get hey, all this went wrong, what happened, and we're here to look at it and realize that as human beings, mistakes, that, we should have done this protocol or this plan, or we should have triggered you here, and we always want to look to making it better. But we're always doing our very best each and every day. So again, miscarriages, same thing. Change the diet, meditate, visualize, vision board, and we're here to share more and more. Hey Maria, diagnosed with liver disease, non-alcoholic fatty liver disease. Liver enzymes were elevated, but will this keep us from proceeding with IVF? So non-alcoholic fatty liver disease is actually the most common thing. It's due to eating fruits, fiber, vegetables, which are all on sugar, and lean meats, because protein, amino acids, and sugar goes to the liver, and it's converted to fat, and it causes glycation, all right? That glycation causes the damage to the mitochondria, which damages your liver, elevates liver enzymes. So again, keto, 12 to 24 hour, get rid of all those fruits, fibers, and vegetables. I know it doesn't make any sense, but it really works. And waiting for that inflammation to subside, then IVF, IUI, or natural pregnancy can work and help in the process. And 15 minutes, keep the questions, keep the shares and likes and loves, and we're throwing it back at all of you, by the way, and really appreciative. Let's see. Hey, Christine, how you doing with your new baby? We miss you. It's an amazing team I have at CMI Fertility, and this week is going to be Nurses Week. But every day I am grateful for maintenance, secretaries, financial, the front office, the back office, the nurses, the laboratory, embryologists, technicians, the docs, the practitioners, because without all of them, we couldn't provide this for all of you, and without all of you, I don't like to fish or play golf, by the way. I'm bad at it. It's interesting. So our job is to help, motivate, support, and I'm sorry if I don't get a chance to personally connect with everyone, but I really work that our energy, my energy, and our docs share similar ideas and energy. So, if you're not getting it from the person you're in front of, please, I'm always there to share and connect and add the story. Keisha, should B12 injections not be I don't know a lot about B12 injections, and I will check it out. But basically, get rid of cyanide, whatever it is. And keto, in general, reduces the amount of plant toxins in the body. And I hope I've really been answering a lot of questions that are appropriate for everyone, and I really appreciate it. Daniela would like to know, what is your opinion on weight and IVF? Well, and all the treatments, but basically, if we're overweight, a little, a medium, or a lot, it's simply an indication of what we're fueling our body with, which ultimately is the toxins. And so in 2 to 4 weeks, by eliminating the toxins, that is the carbs, and going keto, paleo, it really, really will help in the process. And so it's not the obesity or the fat, it's the carbs and the sugar and the plant antigens and the phytochemicals and the fermentation in the gut. We're brewing beer in our bellies every day, and that brewing beer causes heat, alcohol, aldehydes, methane gas. And so we're denaturing the proteins, the hormones, and we're causing inflammation at the microvascular level that causes blood clotting that just trashes our testes and our ovaries and the uterus. And so in the damage to the mitochondria, the excess glucose in our bodies due to fruits, fiber, vegetables, and forget about the worry that somehow the candy and the crackers, I mean, those are factors, but the real bad factor is going to be we're eating salad, which is being recalled all day long. We're eating vegetables that are, quote, healthy, but they contain bacteria, yeast, and plant antigens and phytochemicals that even I at first said, oh, come on, how could these be bad for us? Whoa, it's crazy amazing. And the more I've done this, the more I've practiced it myself, I am on fire. And my job is dedicated and committed to sharing these new ideas of the CNY fertility way in every way possible. So again, the weight is a factor because of what you're eating, not the weight itself. And I'd bet $1 billion on that one. And any weight you lose, it means you're using the calories that you store for energy, which is all we do anyway. And if you're losing weight, it's an indication your metabolism is going in the right direction. And so many people are dropping 20, 40, 60, 80 pounds fast. Hey, Lisa, what protocol for FET? Only 4 embryos made it to freeze. We're doing a PGS, so we may not have many. Again, we never know. That PGS isn't always accurate either, by the way. So like a soccer ball, there's black and white little dots on the soccer ball. Depends where you biopsy the embryo. You might get black or white or a mixture, but it may not be reflective of the actual baby. And so there's some evidence that there's a higher incidence of false positives when you're late 30s and early 40s. We really can't say exactly how accurate or inaccurate they are. If you have a lot of embryos and we're trying to only select the 1 or 2 and minimize the number of transfers, there may be more value than if you only have 2 or 4 embryos. And I have my opinion. I'm not against PGS. It really is individualized. We need to discuss it, and it needs to feel right. We look for male or female for those that are interested, and PGD is looking for a particular genetic diagnosis. And so we're always, that's another one. Natural FETs or letrozole trigger FETs all work nicely. The medicated estrogen, and then when the lining is 7.5 to 8.5, then we'd add progesterone or trigger if it's the right way in order to get you to that transfer, which is usually 4 days after progesterone for a day 3 and 6 days after progesterone for a blast. The ERA may help, but typically that ERA test is usually signaling day 6 of progesterone. So it's an added cost. And Kimberly, lost 60 pounds, which you are using the energy, really, that's it more than anything. And Lauren, How you doing? Autoimmune and adrenal issues affect egg quality. Remember, the inflammation in our bodies is causing the adrenal damage, the egg damage, and it's autoimmune, but really it's not autoimmune. It's an immunologic reaction of our bodies to foreign molecules, chemicals, and entities that get in our body, whether we consume them, we breathe them, or they get through the skin. It's quite amazing story that I've learned. And the adrenals, right on top of the renals, so liver damage, adrenal damage, thyroid damage, ovarian damage, our recommendations of food and exercise diminish the blood flow to the core, cause the damage everywhere. And so the amazing story, Keto's King, and the Magic Pill is a movie that I just checked out. I can't remember if it was Netflix or Amazon Prime, but check it out. It's about keto, and it's showing how cancer goes away, diabetes goes away, hypertension goes away. And again, we're not here telling people, boy, you better be thin, because let me tell you, plenty of lean, thin people have all the same inflammatory problems because they're eating the wrong things. And keto is king, and Maria is really amazing. And the Magic Pill, thank you, Karen. Netflix, it's a great one. I just watched it last week. We must have watched it at the same time. But it's really just sharing the story that we are what we put in our minds and we put in our mouths. And what we've been super marketed as healthy is just selling another thing, but in fact, our bodies require very, very little. We require fat and a little bit of protein, and our requirements for carbs and glucose is 0. That means, remember, vegetables, fruit, and fiber are sugar. I'm sorry, it's an easy, simple story. The more I've done this, boy, and Tanya, Lauren, Sarah, Jess, Jen, Karen, Carol, and Amber, really, I'm so grateful to everyone. And if I'm not mentioning so many names, please accept my apologies. Intention is get Maria back on. Check out Carissa Marie's web, her story. But share your story. And it's hard sometimes to share because it's such personal and we are afraid. And it's natural to be afraid, by the way, for all of us. But in our fears, we step forward. You know, I always say when I feel the hurt here, it means it's kind of pushing me to go forward. Take a risk. And you know, if you put $10, $20, $30, $40 in a baby bank every day, at the end of that month, 6 month or year, you'll have more for the funds to help create that baby. And whether it's fertility treatments or au naturel or adoption or helping someone else out on this journey, you know, it's really about sharing. What protocols did so-and-so do? And wow, I had this. And the more we share that, it really is, it's crowdfunding source, crowd fertility management. And I'm telling you, Dr. Google really sometimes has some amazing stuff. And I've been working with Dr. Kwok Kim, Dr. KK in Chicago, Alan Beer's program, and really, in Toronto, Markham Fertility, and check out LIT, leukocyte immunotransfusion. I know it's a kind of a crazy idea to take the guy's white cells and inject it under the woman's skin. But it really, really, really helps. And one of our patients went to Mexico, to Nogales, to do that. And the border guard asked where they were going. And he said, oh, my wife and I did that. And we conceived and delivered a baby. And IVIG, listen, IVF is expensive. IVIG can really help so many when everything else is failing. And the miscarriage, negative pregnancy tests hurt a lot. And I'm sorry if I can't be there for everyone in one way or another, but I feel it and it hurts. And helping is what we're all about, even when it's painful. And we're all working to listen and listen and listen. And crowd fund for service dog, Kishai. You know, it really is so many ways to help people out there. And by listening, learning their pain, their hurt, and be patient with yourself. And remember, every day, start the day with thank you, God, nature, creator, and look in the mirror with love. And standard fertility treatments help a lot of people. And why some people get help and other people don't, believe me, I haven't figured that one out. But it's really, 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 really an amazing, amazing story. We've got a couple more minutes. Jen would like to know if Gonalef and Follistim are the same. Well, they're slightly different. They're made by different companies. And in general, we use both. We're really working to get the prices and the most affordable care. And through Integrity RX in Colorado, we've been working with Cornerstone and Kings and Metro and Freedom. The key is we're looking for your ways to find the most affordable, and getting that expensive to get them. Let's push the cost down, and it's through that crowd fertility funding and helping. And I'm pushing all the providers to give us the best price on fertility meds, whether it's IUI, IVF, IVIG, LIT, whatever it is. And back to Gonalef, Follistim, I don't have a preference. We use a lot of Gonalef, a lot of Follistim, the overfill, so look for the multi-fill doses and ask for the very best pricing from those pharmacies. All right, Mike would like to know, one failed freeze-all with PGS and one failed with PGS and ERA. 6 days of progesterone. What else should I do to make the next cycle a success? Hysteroscopy, DNC, endoscratch, intrauterine HCG, intrauterine Neupogen, weekly intralipids, up the Lovenox 30 to 40 twice a day, prednisone 10 twice a day, LDN. If you haven't had a laparoscopy to look for endo or remove fibroids, it may be something worthwhile. Humira, Plaquenil, Prograf, immune, and don't give up. And if it's, maybe look towards a natural cycle, the trigger, and then a transfer. Letrozole with trigger for some. Sometimes the challenge is the timing. And if you're traveling, the medicated, then the progesterone gives us a better timing for those traveling a long distance, but really working to make it as flexible. Last minute question or two. Again, thank you for sharing this, sharing the likes, and we are sharing the likes right back to everyone for supporting the travel. But again, I talk to clients everywhere in the country and the world, and it may simply be that conversation that helps you see a different angle and way. Tawana, I haven't had a period since March after I did hysteroscopy. It can be normal for some, but hysteroscopy, let's not wait for the period. Let's get you right in for baseline ultrasound and blood work and get you started. So one of the things I'm really working on is if you have a hysteroscopy scratch, don't wait to call with your period. Let's get your baseline ultrasound and blood work, get you started. And the same goes with HSGs and so many other things. Hey, Megan, how you doing? Miss you guys. How's the family? And from so many of my clients, like Megan and others, Alexandrina, I've learned how to take the game to the next level. And, I've worked with Dr. Braverman, really awesome, great ideas, helping take it to the next level. And so many in this world have helped shared. opposite ideas that really, really work. Just kind of sift through, see if I can find a few others. Hey, Ashley from Indiana, Michigan, Ohio, just amazing from everywhere in the United States. And share the words with your OBGYN. Let us know. We'd be glad to send them a stack of our magazines so they can really help learn more about fertility, integrative, natural, and even that IVF is not $20,000. You can do 4 IVFs for $20,000 and it really significantly bumps your odds for success. And we do some PGS, PGD financing for the in-house component, but we're going to be working with a new financing company that may help get you financing for your meds and all your other treatment, including your travel. So that's something really we're excited about. And Ashley, I'm going to try my very best to get to you earlier. So, if it seems like a long way out, let us know. We'll try to get you guys in earlier. January 2019 cycle, that's perfect. Lost one testy because of testicular cancer and the other undescended. Been together 8 years. And hold the faith always. Don't give up. Begin to look at how to fuel your bodies and reduce inflammation. And again, Maria's new book on keto, and she's got just such an amazing number of books that help you get to keto, and she's got the Keto Adapted book, and that's really a lot how I learned about all of this. But one of the things I've really focused on is, listen, if you're not keto or paleo, it still can work, and those are just some avenues to go down. If you're vegan or vegetarian, there are some ways to reduce inflammation by narrowing what you're putting in your body, by eating less frequently. Add eggs, cream, butter, really can help add fat. It reduces inflammation. There's so much evidence on that. Joyce V, when you do a lap and hysteroscopy and scratch frag retrievals done at CNY, so we do it both at the Syracuse Surgical Center and also locally at Krause Surgery Center, and in Albany, our Dr. Grossman and Dr. Ditkoff do them locally. And we have some docs that will help us in our Buffalo, but really we want to work with your OBGYN doctor that can help us in this. And simply, if they're not sure, you're not sure, give them my cell number, 315-416-9872. And I really appreciate everyone's patience and the communication, the conversation. I really try my best to get to everyone. If you're not hearing from me, text me again, call me. I pass it on to my team. They're really wonderful in the process. And, check out Resolve. Talk to your local representatives. Talk to your employer. How to make fertility more affordable. Ask them, hey, did you know that CNY Fertility offers a much more cost-effective method and may able to help you and others in your on your workplace to have the success that others are having, no matter where you live in America or in the globe. Let's see, one more question. Thanks, Nicole. And I try to meet with everyone. Dr. Corley is amazing. Dr. Grossman, Dr. Ditkoff. We have slightly different paths in the process of communication, but our nurses and everyone really work to help listen and give us to that next level. All right, Carissa, thanks. Last question. And again, send them to the Facebook. We'll look them over. We'll work to get them out to you. Justine has taken a lot of emails. Our Albany, Syracuse, Rochester, and Buffalo offices are amazing. We're working to open an office in Atlanta, but really your OBGYNs, your primary care can help you on this road. Ask them, hey, I need an ultrasound and some blood work. Can you help me? And it's my only way to family building. and check with a local ultrasound. LabCorp is everywhere. We have the ability to have those bloods shipped directly to us and get them to you quickly. Prepping for FUT, how often should I be doing lipids and IVIG? Heard a week before transfer, a week after. So the lipids I generally recommend weekly. If you can get a week after and continue up to 7 to 12 weeks after pregnancy, and sometimes even longer. IVIG monthly, depending on the story, it may be every 2 weeks. Preferably IVIG 2 weeks prior to transfer, intralipids a week. It may be earlier than that. And keto is the key. And all right, Amber, because I think this is a good one. Moc Transfer. In general, we do the Moc Transfer, the time of the transfer. We pass a trial transfer catheter. With ultrasound, we see exactly where we need to go. We pull out the inner catheter and place the catheter right through that with the embryos. I've found that works the very, very best. It may be that you need to do a mock cycle way ahead of time because we need to make sure your estrogen, you respond appropriately, and it may be to do an endometrial receptivity assay biopsy, and so those are all really, really good things. And if you've had a negative test, don't give up. I've seen multiple times. Persistence is key, but this is where keto, immune, Kiltz is really narrow keto diet. I don't like to call it a diet. I call it the baby plan. And check it out. Again, I'm going to sign off. I'm going to really work hard on doing these weekly. And the more you share, the more affordable babies are out there. And I think it really shouldn't be, your mortgage, everything in order for this to happen. But those things in life that are the most valuable do take a little bit more work and vision. So God bless to all. And thank you so much. Thanks to Will. Thanks to my entire team. And share gratitude to nurses and everyone out there. But our gratitude to you, and in the hard journey, keep at it and look at your options. God bless. Dr. Rod Kiltz, CNY Fertility. Enjoy the journey. Take care.